Well, we have both amount of audience. We have some candidates who already have GMC registration, very well done, and who don't have GMC registration, don't worry, we have many options, and I will explain each and every pathway in detail. If you're interested in pursuing a career in ops and gynae in the UK, then this is the right place for you to know each and every parameter about all the pathways which makes you a consultant in the UK.
Ma'am, please also let us know, should we go for the part 2 MRCOG after clearing part 1, or should we go for the PLAB route?
Yes, definitely. Thank you for highlighting this. Okay, the question that I asked you, that how many of you have GMC registration or not, this is very important because one essential requirement for working in the UK is your GMC registration. And GMC stands for General Medical Council, which is the regulatory body for the doctors in the UK. But how can I obtain my GMC registration? Do you have any idea about any route? I have seen some messages. Some of the students already have their their GMC through PLAB route. Do you have any idea how many routes are there if you want to get your GMC registration? Yes, Dr. Salma?
It would be better, madam, if you'll explain all the routes and pathways so that everybody will come to know.
Okay, yes, sure. So in IMG's routes to GMC registration is either you can have your GMC by PLAB. If you're going through the PLAB route, then you have to sit in OET or IELTS. Then you have to write PLAB 1 exam, and then you have to write PLAB 2 exam. And once you successfully cleared all these exams, you can straight away apply for the GMC registration. The other pathways, acceptable post-graduate exams like MRCP, MRCS, MRCOG, or MRCPCH, etc. Then the third route might be MTI sponsorship. What is MRCOG? It is the exam of Royal College of Obs and Gynae, which offers a highly respected membership exam known as MRCOG. This exam is internationally recognized as a gold standard qualification in the field of obs and gynae. That means it is globally accepted membership exam. That means if you have your complete membership of Royal College of Obs and Gynae, then you will be considered as a consultant, or you could be recognized globally in many countries. This exam has three parts. Part 1, which is your written exam, that classically tests the candidate's knowledge of basic and clinical sciences relevant to the obs and gynae. Then the second part. This is also a written exam, but focuses on the application of knowledge and problem solving in clinical scenarios. That means part 2 exam is more about your clinical management rather than the basic clinical knowledge. Then in the part 3 exam, this is a clinical skill assessment exam evaluating the candidate's ability to apply their knowledge in the practical situations, including their communication, clinical skills, their professional ethics, their interpersonal skills, and everything. Okay, since we are talking about different migrant routes, let me show you the GMC website. They have mentioned different types of postgraduate exams. They are not just only MRCP, MRCS, or MRCOG. Let me go on the website. Okay, here they have a section, acceptable postgraduate qualifications. If you have one of the postgraduate qualification listed below, we can accept that as evidence that you have necessary knowledge, skills, experience to apply for full registration with the license to practice. That means for the GMC. So let me go through from the list. Anyone in the audience from Australia or New Zealand? Okay, anyone in the audience from Bangladesh or Canada? Okay, Dr. Sangeeta, I'm coming to that point. Here we have a list of Ireland postgraduate exams, which are recognized and acceptable in the UK. And on the basis of these exams, you can apply for GMC registration. So they have mentioned when it comes to the Ireland, they accept the Fellowship of College of Anesthesia of Ireland. Then for physicians, here they have mentioned they can accept the membership of Royal College of Physicians of Ireland, which is in Obs and Gynae, which is your MRCPI, awarded after 1st of January 2007. So this is your answer. And they do accept some postgrad exams from Malaysia, Singapore, South Africa, Sri Lanka, US, and West Indies. So they have a full list. So if you have any of these specialties or postgrad exams, you can apply for the GMC registration. Okay, if you have passed your part 1 MRCOG, then you can directly write MRCPI part 2. I hope I made it.
Any shortcut, ma'am, after passing MRCOG is part 2 is more difficult than MRCPI, or they are equivalent, like in difficulty level?
Okay, it depends. It all depends on your background knowledge, your clinical experience, and and most importantly, whenever it comes to writing any exam, your analytical skills are very important. Like how you can manage that scenario, how you can solve that question. So all of these meters, and everyone have their own mindset. However, if I compare the curriculum, so MRCOG2 curriculum is way more extensive as compared to MRCPI. Okay, let's move on. Okay, for instance, because this session is solely dedicated for the obstetricians and gynecologists, because I believe when I was struggling at my time, I was taking different exams and I was very confused, like which pathway should I follow? I learned this in a very hard way. So now the purpose why we have arranged this session is to make everything simpler and easier for you. So what happens for those who are following MRCOG exam route? Let's imagine they have cleared their MRCOG 1, 2, and 3. And once you clear all the 3 exams of Royal College of Obs and Gynae, you will get your full membership. But in order to get your GMC registration, you need to write English language test, which might be OET or IELTS. And once you have your language evidence, then you can straight away apply for the GMC registration. And once you got your GMC registration, you have 2 pathways in front of you. Either you go on the right side or either you may go on the left side. So there is a training pathway and then there is a non-training pathway. I will tell you what is the difference between training and non-training pathway. Then we will move on how we can go into training and how we can follow the non-training pathway. But first, you need to know what is the difference between training pathway in the UK and what is non-training pathway in the UK. So training pathway is a structured formal program designed to lead to specialist registration in Obs and Gynae. It involves a series of steps and assessments with the goal of becoming a consultant. That means if you're entering into training pathway in the UK, ultimately you will come out as a consultant. Advantage is clear career progression, structured training with mentorship and educational support, eligibility for specialist registration upon completion. So this is about training pathways. And what is non-training pathway? This pathway involves working in obs and gynae roles that are not part of structured training program. It is often chosen by the doctors who may not have secured a training post or by those who prefer a more flexible career route. Because if you are going into training pathway, that means your working hours would be a bit strict, your duty would be a bit strict. But in non-training pathway, that is a way more flexible path. So if anyone who is preferring that he or she wants to work in obs and gynae, but at the same time, they do have some limitations. They want to manage some of their personal things, like they want to spend time with their family. So for those doctors, non-training pathway is a better option. But those who are truly dedicated and who do not have some special circumstances, they are good to go with the training pathway. Advantages of non-training pathway are flexibility in career choices and work-life balance. So this is a good thing about this pathway. And anytime, what does this flexibility in career means? That means anytime, by any time, you can write the MSRA exam and enter into training pathway. When you feel ready, just give the MSRA exam and go and jump into training pathway. So you have this option all the time. Opportunities to gain experience in obs and gynae without the pressure of exams and structured training. So who want to spend an easy life without any pressure of exams, who hate learning? But I think after passing MRCOG 3 exam, you already have studied a lot, but still, for those who have their GMC through PLAB route, they can stay on this pathway as well. And whenever they feel ready, they can enter into training pathway. Possibility to apply for training post later if desired. Limitations. What are the drawbacks? If you choose non-training pathway, limitations, not direct pathway to becoming a consultant. Less structured educational and career support as compared to training pathway. May require additional steps to gain specialist registration like CESR certificate of eligibility of specialist registration. That is another route. If you want to become a consultant in obs and gynae in the UK, then still you have an option.
Ma'am, I have a question.
Yes.
I'm associate professor in India, Mumbai Medical College, Government Medical College. I have done my MS DNB and I have a experience of almost 11 years. In 2011, I passed. Then I'm working as an assistant professor. Now I'm associate professor. So what is the fastest route for me? Like, so after clearing MRCOG to get the job as a consultant. So here you are telling again you have to give as a CESR certificate of eligibility as a specialist, not as a consultant. So after clearing MRCOG, I have to again go for ST3-4 and then become a consultant, or with the on the basis of my experience in India, Mumbai, I can after clearing MRCOG, I can become a consultant directly.
Yeah, I got your point. First of all, you are doing great in your life. I'm really, really impressed by your experience and your expertise. Since you have a lot of clinical experience, then definitely you are not eligible for ST3, 4, 5, 6 route. In your case, you need to directly go in the consultant pathway. There are some exams and there are 3 different categories. We can do another session on that. We have CCT pathway, CESR pathway, and there is another pathway. So you fall in that category. Did you get my point?
Yes, sir. Yes. So for that also I need to clear MRCOG, right? All the 3
Yes,
steps.
you should have that. Yes, definitely. You need to have MRCOG 3.
Okay. And after that, I will contact you for that program.
Yes,
What you
exactly.
have just recommended. Okay.
One thing I want to clear, just passing MRCOG 3 exam in your home country doesn't make directly a consultant, make you a consultant in the UK. If you want to become a consultant in the UK, then you need to follow the pathways which are most suitable for your category, like CSR or CCT pathways, which are especially for the consultants, for the doctors who are very senior, who have their membership exam, who are doing great in their home country. Then they need to follow that consultant pathway, which is above this one.
Okay, CCP and CSR, right?
Yeah, there is another one. I have that slide. I will show you.
Okay, yeah.
Okay, this is how the training pathway in the NHS looks like. Okay, there are two chances for you to enter into the training in the NHS. One is either you can directly enter into the ST1 pathway, which is the very first year of your training, and the other one is your ST3 pathway. The doctors, I know I have two types of audience, so I need to address both of them. Number one, those doctors who have their GMC by the PLAB route, the most ideal situation for them to go enter into ST1 training pathway. And for those who are trying to go and having GMC with the MRCOG pathway, then your chances of entry is into the ST3 pathway. Okay, what happens? Let me give you a brief. Those who are really interested into the training program, what happens? Yes, you get your training at ST1 level in the NHS. It is classically divided. The total number of training years are 7. The first two years are the stage 1. Then stage 2, then we have advanced stage, which is year 3. This stage 2 is moderate stage. And all of these, as they are moderate and advanced stages, they have the clinical experience and the knowledge. The NHS assess the doctors on these bases. That means if you are at the stage 3, that means you should have advanced clinical experience and the knowledge and the expertise. So they expect something high from you, but in stage 1, they don't expect much from you. However, the curriculum for ST1 and 2 is different. Curriculum for ST3, 4, 5 are different. And for stage 3, the RCG curriculum, which they expect from their trainings, is different. So you grow with time. Okay, in the UK, the doctors who are doing their training in the UK, what happens? MRCOG 1 is not needed at the time of entry in the training program. But yes, once you clear your first stage, then it is mandatory for everyone to pass part 1 MRCOG. Because if you don't clear your exam at this stage, you cannot be promoted to ST3 level. So it is mandatory here. Now, if the trainees clear this exam, they would be promoted to ST3, 4, or 5 level. But once you reach to ST5 level, you have to pass your part 2 and part 3 as well. If you don't clear these exams until this stage, then you would not be able to promote it to ST6 or 7 level. So this is all about the training structure in the UK. It is a brief overview. Like you have a crystal clear orientation about your targets, about your goals and your aims. And please make yourself clear that what they are expecting from you. And if you choose this pathway, what things you need to keep in your mind. So make yourself clear. Let me clear another thing. Those who have their PLAB 1, who have their GMC registration, and who have their Part 1 MRCOG1 exam, what is the role of Part 1 exam if you clear that before ST1 level? When you apply for the specialty training, you need to write MSRA exam, you need to appear in the interview. However, your Part 1 exam unfortunately, do not hold any marks or scores in the interview, but in the interview, they specifically in one station, they ask you about your commitment to the specialty. And at that time, if you show that I do have clear my Part 1 MRCOG exam, that shows your specialty commitment. And that makes a good impression on the interviewer that you are really into obs and gynae. Because what happens, there is a trend in UK The doctors who get into the training at ST1 level, the dropout ratio is very high. Like many doctors who start working in obs and gynae, but later on, some of them didn't join and some may drop their training. So that's why they need to check that if we are taking any doctor in our specialty program, they are truly committed to the specialty to avoid that dropout rate. Am I clear?
Ma'am, I have a query.
Yeah.
Ma'am, actually, the way you have mentioned that is perfect. But the way you are saying, like, training has to be done. So after clearing all the parts, like 1, 2, and 3, we have to stay in UK for the training part, and will it be a paid service, or we have to pay from our pockets?
Definitely, it would be paid. And
It
it
would
is
be
not
paid.
possible. Yeah, it would be paid. I will show you some salary packages at the end of the session. Don't worry
All
about
right.
it. Yeah. Honestly,
Thank
it
you,
is
sir.
not possible for anyone to survive in the UK if you are not earning.
Yeah, that's my concern.
Yeah, it's not possible. Truly, it is not possible.
Okay, thank you.
Inflation is globally inflation is very high. So you can't afford your everyday expenses if you are not earning.
Yeah, ma'am, that was my concern.
Yeah, definitely it would be paid.
Because already we are paying so much for the part 1, part 2, and part 3, and right now I'm just preparing for part 1. It's long way for me to go to reach
Yep.
there. That's my concern. Thank you so much for clearing it.
No problem. Just trust the process. And one thing, whenever you are going and following any migrant pathway, if you want to move to the UK, to the Canada, to the Australia or US, the journey is very uncertain and the things takes time. So don't rush the process. Have some patience. Keep doing hard work and have faith in God.
And ma'am, MRCOG helps for the Dubai and Singapore as well?
Yeah, in UAE, especially in the Middle East, Royal Colleges exams are very, very recognized.
Okay, thank you.
They
Hello,
love to.
ma'am.
Hello.
Can I ask a question?
Yeah, sure.
Ma'am, I have done MRCOG Part 3. So if I'm going to a training pathway, so I will join from ST3.
Yeah.
So for ST3 post, I have to take MSRA exam or?
Yes, MSRA exam happens at this stage before ST1 for ST1 recruitment and then for ST3 recruitment.
That will be the same for ST1 or ST3.
Yes, but the prerequisite would be different. That means for ST1, they have different essential criteria. And for ST3, they have different essential criteria. I will explain. I added slides on this as well. Because I already knew I'm gonna get these questions. So I'm fully prepared today.
Okay. One more question, ma'am. If I'm going to the non-training pathway, then what post I should apply for?
Okay, I also made some slides on that.
Okay.
I will show you. Okay.
Okay. Thank you, ma'am. I will be waiting.
Okay. Okay. So what is since the doctor, I forgot to see your name, but he was asking about MSRA exam. So what is MSRA? Basically, it is another exam, which is multi-speciality recruitment assessment exam, which is a computer-based exam used in the UK as part of the selection process for various medical specialty training programs. It is common as an assessment tool used by Health Education of England for recruitment into multiple specialties, including general practice, radiology, psychiatry, obs and gynae, and others. What is the purpose of MSRA? Basically, it is designed to assess candidates' aptitude for specialty training. That's it. It is often used as a part of initial screening process, and your performance on the MSRA can significantly impact your chances for securing a training post. And the good thing here is that there is no registration fee for MSRA. So finally, something is free in the UK.
That's good to know.
Yeah. Okay, before we move further, I want to give a reminder that we are currently offering our MRCG Part 1 Premium Long Course, which is for 5 months. Those students or candidates who are interested in going into MRCG pathway, there is a good chance for them because the next exam is on January 2025. And in this course, we are offering a main schedule and mini schedule for strategic study approach. We have live sessions on all the subjects on all the modules. Then we will also provide the live sessions recordings, all the books which are relevant for this exam preparation, subject-wise mocks, subject-wise recalls. We do have PDFs of our live sessions. Then at the end, you will get big mock exams and yes, website access of all the study material. So those who are interested in going into MRCG pathway, there is a good chance for you. And for those who just cleared their Part 1 MRCG exam, we are offering MRCG 2 Premium Long Course, which is for 8 months and classically designed for the candidates who want to appear in the July 2025 exam. This course would include live sessions on all the topics. Session recordings would be available for review, exclusive EMQ discussion sessions, module-wise course schedules, daily topic, question discussion, talk written summaries, screen top guidelines and summaries, NICE guidelines, consent advice summaries, BASH, FSRH guidelines and summaries, then ASHRAE guidelines and summaries, FIGO, organized summary by modules. Then we have module-wise topic test, talk article SPA question bank, CTG flashcards, special sessions on biostats and clinical governance, mock exam, and yes, 24/7 Telegram support until you clear your exam. So these are the features of our MRCG2 Premium Long Course. And then there is a third course we are offering for those students who want to appear in MRCG2 exam in January 2025. What would be included in this package would be live session recordings, written summaries of all the guidelines, including BASH, oncology, FSRH, NICE, CTG, SIPs, talks, and consent advice. Organized and dedicated schedule, group mentor for support, dedicated group for e-course, updated recorded lectures, important exam question workshop, dedicated Telegram group for discussion, mentorship available for Telegram workshop as well, references for exam question during discussions. So these are all the features which are included in our MRCG2 Premium Long Course, which is for January 2025 batch. Now, getting back into training pathway through MSRA. I already told you there are two chances for you to enter into training pathway, either at ST1 level or either at ST3 level. So what things you need to do if you want to book MSRA and write MSRA? First step always would be your application and long listing by the Oriel. The prerequisite is you need to have your CREST form, 2 years clinical experience by start of training. Your F2 competencies should be signed off. That means you should have, again, you should have 24 months of clinical experience, which also includes your internship experience. That means, especially this, I'm talking about ST1 level at this time. For those candidates who already have their GMC by PLAB2, this is for you. You need to have 24 months clinical experience. That means 12 months for your internship and 12 months after your internship. Then yes, GMC registration is a must. What is included in MSRA exam? There are two papers, paper 1 and paper B. One paper is your professional dilemma paper, in which you will get 50 questions and you need to solve these 50 questions in 95 minutes. Your other paper is clinical problem solving paper. You will get 97 questions and you need to solve these 97 questions in just 75 minutes. And both of the papers have equal weighted marks, 50% of each, and minimum band of 2 in each paper to get ranked. That means there are banding system in MSR exam. If you get band 1, that means you failed the exam. So a minimum of band 2 would be considered you as you passed the MSR exam. Okay, one thing I want to clear. There are 3 similar type of, you may say, sister exams. One is PLAB1. MSRA clinical problem solving paper, and your MRCP part 1 exam. These 3 exams have kind of similar type of topics or similar type of guidelines or level of expectations of knowledge. However, the difference is PLAB 1 is at easy level, MSRA clinical solving paper is at moderate level, and MRCP 1 exam is at the hard level. This is the difference. Now you should maybe you can get an idea. If you are studying for MSR exam, the clinical problem solving paper maybe look like your PLAB 1 exam, but it is a mature version of your PLAB 1 exam. It would be a bit difficult than that. Now, the point is how you will get your ST1 training. What is the criteria and how will you get into the training program? Now, imagine you have written your MSR exam. Now, what is the next step? How would you be scored? I'm classically talking about the obs and gynae because every specialty have their own criteria. So now in today's session, I'm just talking about obs and gynae criteria of ST1. Okay, you have written your MSRA scoring. That would be make up your 33.3% only, which is not a good thing. Previously, it was 50%. Previously, they were used to take 50% MSRA score and 50% your interview score. But now it is 33.3 your MSRA score and rest would be covered by your interview performance. Okay, MSRA score will be used to shortlist you out from the lowest scoring applicants and bypass the highest scoring applicants to offer stage. That means if you scored very well, and there is another thing, if you ranked very high in your MSRA, if you become in the top 75, then automatically your interview would be excluded. You will be directly shortlisted and you got your job offer directly. If you pass the MSRA but do not reach the bypass score, you will be ranked and invited to interview based on interview capacity. The MSRA will make up a percentage of your final score. Then after MSRA, for instance, you got shortlisted, you got the highest score, and now you are invited. But yes, the top 75 would not invited for the interview. They will directly enter into the training program. They will directly got their job offers. So now for the interview, that means if you are the first person who got the interview, that means you are at the 76th number or in overall list. Because 75 candidates, they do not have to go through the interview. So your final MSRA and online interview score is out of maximum of 150 marks. 50 marks from the MSRA and 100 marks from the online interview. That means now you're invited for the interview. The interview have 150 marks. In this 150 marks, 50 marks they will give you on the basis of your MSRA performance, and 100 marks would be given you by the panel of the interviewers. Please note that the highest scoring applicant who attended the online interview will be ranked after the lowest scoring MSRA bypass applicant. The highest ranked applicant who attended the interview will be ranked around 76 overall, because 75 were directly entered into the training program. Again, you can see here, raw marks by the panel member are 50, which is from your MSRA assessment. Total marks are 100, and the percentage of final score is 66.66. Limitations. This is something I want to clear. And honestly, this was the purpose why was the second purpose we conducted this session, because if you want to enter into the training program, you should be fully aware about the criteria. When is the right time? What is the right pathway for you? And you should go through ST1 or ST3 pathway. So that there are some limitations. If you want to enter into ST1 level, then your maximum experience permitted is 24 months in obs and gynae. What does that mean? If you have a clinical experience in obs and gynae of more than 24 months, that means you are overqualified and you are not able to enter into ST1 training program. Am I clear? This is something annoying and this is something bad. And another thing which makes you overqualified is your MRCG 2 exam and 3 exam. It also made you overqualified for ST1 level. These are some limitations. If, okay, again, for those who have their GMC through PLAB route, please make sure you do not have more than 24 months in obs and gynae clinical experience, which do not include your internship experience. It is classically counted the day after you have done your internship. And yes, MRCG2 is not the right time for you if you want to enter into ST1 criteria. Now, let's talk about the ST3 criteria. Minimum of 24 months of experience in obs and gynae you should have. Now, those who are working in obs and gynae in their home country and who are passionate about passing MRCG2 exam, this is for you. You should have a minimum of 24 months clinical experience. There is another prerequisite portfolio of assessment relevant to the ST1 and ST2 curriculum. You need to make sure, provide the evidence that you are capable of the duties that are that are performed by ST1 or ST2 doctor, because now you are bypassing the first 2 years of training. Then yes, you need to have MRCG Part 1 exam if you want to enter into ST3 criteria, because initially I already explained you, they have that set guidelines. The doctors who want to enter into ST3 level, they need to pass MRCG Part 1 exam by any means. Maximum experience desired is 60 months in obs and gynae. Applicants with less than 60 months experience in obs and gynae are preferred. So if you already have extensive training and experience in obs and gynae, just be aware that there is possibility that you might get a place in ST3. In that case, be prepared to go through CESR route instead. This is for the doctor. So I'm so sorry, I forget the name, who's AP in the India. And she was wondering if she need to go through ST3 route or does she bypass the training program? So this is for you. Since you have a very long clinical experience, extensive clinical experience in obs and gynae, which is more than 60 months, that means you are excluded from the ST training pathways. Now you need to go through the CESR route instead. Okay, the timings for ST3 exam, around end of Jan or mid of Feb, the application window opens on the ORIAL. In the April, you will get interview. 2 to 3 weeks later, results would be released. And in August, the start of training. Okay, what counts towards the experience limit? These are the questions I'm getting in the last, from the last 2 weeks. So any clinical experience anywhere in the world as a doctor after internship outside of the official UK Foundation program until the start date of training program is counted. This includes the following: your residency, which you are doing in your home country, your postgraduate training overseas, non-training jobs overseas. That means if you are doing, if you're working as a medical officer or a non-trainee doctor in your home country, that would also count as your clinical experience. Non-training jobs in the UK, even if you are working as a non-trainee doctor in the UK, your experience would be counted. And they would count your, okay, FI1, FI2, and senior house officer, junior clinical fellow. These are the posts or the ranks, non-trainee jobs in the NHS. Some specialties exempt the first 12 months after internship from the experience limit. However, most specialists do not. To avoid disappointment, it is recommended that you do not exceed the experience limits through a non-foundation program job as much as possible. I hope I made my point clear. This is all about your experience limits. Okay, it is mostly concerned when it comes to the surgical training pathway. In the medicine, they have some different criteria. Since obs and gynae is a surgical allied, so they do have some limitations regarding the clinical experience. Yes, Farina, for ST3, we are talking about the ST3 criteria of MSRA exam. So this is the prerequisite. Then what does not count towards your experience limit? Your medical school rotations, your internship rotations, which you have done in your house job time, your observerships, clinical attachment. Some candidate asked me this question, does my clinical attachment counts as my clinical experience? So the answer is no, that wouldn't count in your experience. Official FY1 rotation in the UK, official FY2 rotation in the UK as well. So these are some of the experience limits which doesn't count in your MSRA application. This is a brief about CSR pathway. This is classically for the international medical graduates. Foundation training, yes, you need to have 12 months minimum experience in overseas. You need to provide evidence of ST1, ST2 equivalent training. Minimum of 24 months, your portfolio, yes, you need to have your MRCG Part 1 exam because now you want to enter into the ST3 level training pathway. Then specialty training, up to 5 years of UK obs and gynae training, ST3, 7, plus MRCG 2 and 3 are mandatory if you want to enter, if you want to become a consultant in the UK. Then the CCT in obs and gynae, and ultimately you will come out as a consultant in the UK. Okay, CCT pathway is mainly the pathway which is followed by the doctors or the trainees who are directly working in the UK since the ST1 level. So that because that approach is the training program is very organized, and ultimately you will end up becoming a consultant in the UK, and CCT is for those candidates. And for those who are entering into the training pathway either at the ST3 level, they need to follow this pathway, and ultimately they will become a consultant. If you complete less than 5 years, you will be awarded by CESR. So ultimately, you have you have that option of becoming a consultant in the UK. Okay, is everyone clear? If everyone is clear about the training pathway, then I will move on to the non-training pathway. Yes, Dr. Salma, I'm afraid. Yes, if you exceed your experience, you deem to be overqualified, and you cannot appear. If you become overqualified at ST1 level, then definitely you are not able to enter at that level. And same goes for ST3. You need to keep in your mind regarding the criteria they are expecting from you.
I have one question, Doctor.
Yes.
So, is there any age limit for ST3, ST4? Like, as I said, I'm already in AP, I'm 40 plus. So, is there any age limit joining that ST4, ST3, ST4?
So sorry, your voice was interrupting. I didn't
Yeah.
get your question. Could you
Is there
please-
any age limit for joining ST3, ST4? As you said, after clearing MRCOG, you can join in ST3 and ST4. So, is there any age limit for that?
No, there is no age limit.
Okay. And for that other consultant group, will you be highlighting today, in today's session?
I'm so sorry. Could you please repeat?
You said there is another way where you can become a consultant after MRCOG 3, where you don't have to join ST3 and ST4 course. So today, will you be highlighting something on that route?
No, we can arrange another session because that is something very advanced, and I
Yeah.
don't want to brainstorm everyone because there is a lot of things you need to absorb, and this pathway is pretty complex. But I'm trying my best to address every concerns. But we can definitely do a session on that as well. No worries.
Okay. Thank you.
That is
Hello, doctor. A quick question, if you don't mind, I can ask now.
yeah, sure.
Yeah. So I have done my PLAB 1, but I have after that I have taken the RCOG pathway. So right now I've got placed in a training job in like in India. So I'm doing like trainee job in OpsKind, and I'm gonna write my MRCOG part 1, 2, and 3. So if I finish this 3 years of training and the exams and get GMC registration, so after that I have to apply for ST3. Is that
Yeah.
what you're saying, or like
Yes, exactly.
so I shouldn't be so I shouldn't be exceeding 60 months experience in the ops kind, but
Yeah,
I can have more than like 2 years.
yeah, that's fine. You're good to
Okay.
go at
So,
ST.
okay. So for that as well, we need to register in Oriel and get through the MSRA exam only, not through the, I mean, not directly through the interviews.
Okay, that has some different criteria. What happens? At ST1 level, they have some weightage. They count your MSI score, and yes, they will call you for interview, and yours both scores would be counted, and collectively you will shortlisted. Same goes with MSRA at ST3 level. You need to provide some initial evidence. You need to make an account on Oriel. You need to write MSRA exam, and yes, then you need to appear in the interview. But they have some different prerequisites. For example, if they are assessing some different things, like if they are assessing your commitment to specialty at ST1 level, because that was needed at that point. Now, at ST3 level, they might ask you some advanced things, like they may expect you to show some good researches in obs and gynae maybe. So the criteria of interview would be different as compared to ST1 level. But yes, you need to follow these steps again.
Okay. Thank you so much,
But
ma'am.
from what you have told me so far, ST3 level would be very, very good for you. I think you should consider that path.
Sure, ma'am. Thank you so much.
Welcome. Okay, so now coming back to non-training pathway. Now, these are for the doctors who have done their MRCOG part 1, 2, and 3. They cleared their OET or IELTS, and now they are GMC registered doctor. And the other category we have are the doctors who again have their GMC through PLAB route, and now they are trying to enter just in the UK. They just want to get a job in the NHS, and later on they want to pursue their career in training pathway. So there are some job options for you. You are able, once you have GMC, now you can directly apply for the non-training jobs in the NHS. The difference between the doctors who came through PLAB route and the doctors who came from the MRCOG route, the chances for MRCOG route doctors are very good, because at this level, the saturation is very low. So there are good chances you will get a good job, a good non-training obs and gynae job in the NHS. However, for the doctors who came through the PLAB route, there is a very saturation at the junior post, like FY2, junior clinical fellow, CT1, CT2. These are very saturated. However, keep on trying, work on your CV. If your CV stands out, if you know how to write your CV in a good way, in an impressive way, then definitely you will get a job offer. For those who came through MRCOG route in the UK, you have the options. You can apply on clinical fellow post, trust doctor, might be ST12, ST35, ST67, teaching registrar, trust registrar, and there are many other academic jobs options available. Like you might apply on a job like research fellow, teaching fellow, senior teaching fellow. So there are many, many options when it comes to the non-training pathway. There are various options. Okay, so the doctors who are coming through MRCOG, as you can see here, now you can work at ST3 or 5 equivalent level. You may also work at equivalent ST6 or 7 equivalent. You may also work as a registrar or a trust registrar. But yes, these jobs are non-training jobs. That means this experience would not be counted as your training experience. Am I clear about this point? Now, I think now you should be very clear about the difference between a training job in the UK and a non-training job in the UK. So this is the difference. However, your
Ma'am,
rank is different. Yeah.
I have a query. Maybe it won't sound good because I'm continuously listening, but I'm confused. Like, even I fall in the category where I have done my master's. It's been 10 years. So where we fall in all this, it's like CESR only or ST 1, 2, 3, 4, 5, 6, whatever you said. That way I'm confused. I'm sorry to ask this, but
No
I'm
problem.
confused.
No problem.
Yeah.
Okay, whenever it comes to applying for the non-training jobs, please apply everywhere. This is what I can recommend you. Keeping in mind the saturation, which is, I think, which is globally everywhere. It all depends. Okay, if you are applying at ST3, you're good to go. You can apply at any post. Either if you want to apply at a clinical fellow, maybe a junior clinical fellow, it's all up to you. However, you will shortlisted according to your caliber, your clinical experience, your expertise, your resume, and everything. So you're good to go with, if you have a good clinical experience, then yes, you are good to go at ST6-7 level as well. Or you can apply for the registrar post. That's all up to you.
Ma'am,
And
but we are like senior consultants here. So does it sound good? Like we should work as a junior person and all. So can we work in that domain, or like it's an ego issue where it's very difficult to work?
I understand this. I truly understand this.
Because now it's like I'm also in my 40s. I'm also associate professor in the respective medical college in India, doing private practice only physically infertility. But because of some reason, I opted MRCOG. So like working as a house registrar and working as a senior consultant and professor. So does it make sense, ma'am, for us to apply for all this?
Okay. Um, this is something which many migrants face in the overseas.
Okay.
However, it is what it is. But there's always a chance to grow. The one
Okay.
thing you need to make yourself clear, one step at a time. What I think, if you want to move it to another country and you have to go to the other country, then take any opportunity which comes to your way. Don't delay the process. Either I'm not saying that you have to apply at the junior post. No, that's not the case. It's all up to you. If you want to increase your chances to get a job approval as soon as possible, then there's nothing wrong with applying at the junior post. But yes, if you have a good amount of clinical experience, then you can apply at ST6-7 level. That is a senior post. That is advanced post. Yeah. So you
So
can
there we are
apply.
not excluded now, ma'am. Like just you said, ki like more than 60-month training, we are not eligible. So we are included for that post, or we are excluded? Because for me it's been 10 years
Okay.
where I've done my masters.
Okay. In non-training jobs, they do not have such
Such
criteria.
criteria. Okay,
You
okay,
are
got
good
it.
to-
Okay,
Even
thank you so
even
much.
even there are some consultant equivalent jobs as well. You can apply on that. If you have a
All
good,
right.
yeah, if you, but again, that is something non-trainee. Your rank would be different as compared to the trainee consultant, but there are some posts in which they expect you a work experience which is equivalent to a consultant. But as you can see here, they have some non-trainee jobs equivalent to ST6-7, but this is not a trainee job. Same goes with some consultant-like jobs in which they expect you to do some jobs which is related to the consultant or the registrar, but you are not truly that in that category, fall into that category. But yes, once you are in the pathway, once you are in the system, even these days, getting into the NHS is a big deal. So
Okay.
if you get a job from the NHS and now you're working in the NHS, feel yourself as a privileged person, because there are many students, there are many doctors who are really truly struggling to find a job in the NHS. So don't make an issue of the ego here, what I would suggest you.
No,
But
I'm just asking, ma'am, because being in 40s and like so much settled in India, just ordering all what all we want. So there will be a lot of difference. That's the reason.
yeah, but everything takes time. Sooner or later, you will get what you deserve. And what you did, your hard work, you will that would be paid off one day.
And
So
ma'am, one more question. Like,
yeah.
if I don't want to work for the obstetric gynec, I want to work in some particular IVF center in UK. So is it possible by this route, or it's something different?
Okay, what
Like
would I?
there's a Homarton IVF center and all.
Yeah.
So there we can apply, or
Okay. Uh, One thing I always recommend, try to enter into the system first, and once you are in the system, then try to explore other things, because
okay,
when you are sitting in your home, you cannot directly have that exposure. For instance,
okay,
if you are applying to a senior job like ST6 or 7, which is a non-training job, even at that time, you have a chance to enter into the consultant pathway through CESR. So you have that option. You ultimately become a consultant in the UK, but all you need to do a bit more hard work.
okay, okay. I got it. I got it. Thank you
Yeah,
so much.
and once you're in the system,
Yes.
you know the NHS very well, how NHS works. There are many options. You may get several leads, like how you can enter into the IVF center. There are some private setups as well. You can, if you have some links, or if some colleague helped you, you can get into the IVF center as well, like those who are working privately. But yes,
Okay, but
I think you should trust the process, get into the system first, and once you are in the system, you will have a better picture of NHS and how things work there.
yes, ma'am. You have very nicely cleared my question. Thank you so much.
No worries.
Um,
And
Madam,
yes,
even I want to ask, like she has raised the question, like as I am associate professor, as I have told you, so after clearing MRCOG 3, can I apply for any fellowship, either through NHS or without, like privately, and get through the consultancy?
okay. For yes, if you have 5 years of clinical experience, then yes, definitely you can go with the fellowship of Royal College of Obs and Gynae.
Yeah. So what is the route for that, madam?
Uh, okay. For that, you need to write some exams again.
Again, okay. After
Yeah.
clearing MRCOG,
Yeah.
okay.
Yeah. For fellowship, you need to write exams again. This is it is what it is. Sometimes I wonder why I become a doctor. I should be architecture, or maybe a graphic designer, or maybe an artist. Life would be very easier.
No, but those exams are like, or like those very lengthy exams, like MRCOG, just a one step, like a kind of a interview with Viva or aptitude test.
Okay, as far as I remember, uh, FRCOG I think it has two parts, as far as I remember.
Hmm. Okay.
Okay,
That fellowship exam, it has two parts.
yeah, I think, but I will confirm that. Okay, I
Okay.
think we need to do some sessions for the senior doctors like you, whether session at consultant level and the post-consultant level.
Thank you.
Yes,
Welcome.
ma'am. It's very much needed for we as a senior consultant in India for a
Yeah,
fair orientation. But you have very much cleared everything.
yeah. One thing I want to reassure, once you are in a system, there is always a chances to grow. It all
Yes.
depends how you keep your eyes open on different opportunities, how you make your links, how you can ask, how you develop your interpersonal skills, how you can ask your seniors for the help. Because in NHS, the senior doctors are very good. They are very helping. They would give you some good suggestions. And once you're in the system, and you may make your contacts, you gather some information, you have the insights of NHS, you may get an idea how the private setup in the UK is working, then you can explore other options. And one thing, you always have a chance to enter into the consultant pathway as well. So this is not, I think, if for a year or 2 year, you need to work at a non-training job, I think that's not a big deal. This is all about patience. You need to keep for 2 years maybe. But again, it depends how you keep your eyes open and how you work hard on different pathways or in the search of different pathways. Because I remember Once I start exploring, I developed that interest to becoming an embryologist. And if you want to become an embryologist, you have very easy options. Like you can do your master's, and yes, you can work in an IVF center as embryologist as well. However, that is clinical. That is something like maybe support job or clinician job, maybe. That is not a truly doctor post, but yes, there is a chance if you have too much interest in IVF or infertility management, then that is also a good option. So there are many ways, many options. Even if you do masters in sexual health, or maybe in the global health, or in STI, sexual and reproductive health. So these are many options which would definitely give you an idea to move and explore other areas in obs and gynae. The problem I think we have in, especially in the Asia, especially if I talk about my home country, Pakistan, whenever it comes to obs and gynae, all of them thinks it is all about obstetrics. They don't explore the gynae, which needs some attention, which need to explore. And there are many, many underlying diseases which are gynecological issues, which are not really addressed in, if I talk about my home country. Yes, they are, some are working on that, but mainly a major portion, they are working on obstetrics only. But when you move into different country, like if you're working in the NHS, you will see how they are focusing more on the gynecology as compared to obstetrics. There are many advanced things. Now, the gynae is very exploring. There are many researches, there are many subspecialties, like they have a different supra-speciality of endometriosis. So now, if you are a consultant and you want to do something more, you can go into endometriosis as well. You become an endometriosis specialist. And now your job is only to deal with the patients who have endometriosis. So this is how the things work in the other countries. So obstetrics is not the end of the world when it comes to obs and gynae. So these are the things which you will explore once you are in the system. This is not possible if you're sitting in your home country or in your room and you expect that every knowledge should come into your pocket.
Ma'am, last question. International publications are required?
Yeah, that would be great if you have that.
And ma'am, like minimum how much and maximum?
It's all up to you.
So minimum at least one is required, right?
Yeah, minimum one is required. I think on the track job applications, they have set the limitations of 5, I think so.
Okay, but minimum one, if we do one, so that is okay. Like
Yeah, you should
acceptability can be there.
what happens when you are filling the job application, try to not leave any area blank. So you should
Okay.
have something in your pocket to add there.
Or yes, yes. Thank you so much.
Welcome. Okay, the salary. Yeah.
I have last question. Like,
Yes.
there are many job option in research zone. So, like after clearing MRCOG, and if you want to know the working system of NHS, so can we take a job of researcher in like related to obs gynae? Like, I was getting one PCOS, like there was some research, but when my husband was already abroad in US, but I was not very keen at that time. I didn't know that doing a research will help you to get the job opportunity. So is it true in UK also, or
Yeah.
it's like in US? Okay, through a researcher, you can, if you have a clinical degree and you get the registration, you can become a consultant. Is it so?
Let me explain you. In the UK, in the NHS, when you apply, when you can check this on the NHS website as well. When you search for a job, there are some different categories. One is the clinical category, and the other one is the academic category. So in the academic category, there are various options. Mainly, they have some ranks on research fellow, clinical research fellows, then teaching fellows and clinical teaching fellows. So these are the ranks there, which are classically academic job ranks in the NHS. They are very good jobs. They would
But
have,
if you take those jobs, you are not actually dealing with the patient, right? You are only with the research.
They are some hybrid jobs as well.
इसका मतलब है सिर्फ यहाँ पर 6 लाख रुपए
Hello.
Okay, basically, in some of the teaching fellow jobs, you work clinically as well, and you teach side by to the students or your juniors. So
Okay, like over here in India, if you are working as a assistant or associate professor in a teaching hospital,
yeah,
you're dealing with both the clinical as well as the academic. So that way. Okay.
yeah, teaching is
Okay.
very crucial. Teaching skill is very, very important for the doctors in the NHS. Even at the ST1 level, you should have to show some teaching skills. Even if I do another session on the interview criteria at ST1 or ST3 level, I will show you they have some markings. They expect you to show some teaching experience. Teaching is
Okay.
very
So my
important.
teaching experience will be counted over there
Yeah,
once I
yeah,
apply
that
for
is
the
very
job.
okay. I wanted to add some job ads in today's session, but I was not able to complete my presentation. So
Sorry.
I prefer to add the essential and not. I decided to make another session for those doctors who are applying for the jobs in the NHS. In that session, I would explain you how you can open up, how you can in a better way search your jobs, how you can assess your application, what is the essential criteria of the hiring, what is the desirable criteria, how you can build your resume, and how you can maintain your CV. So what I have decided to do another session on that particular topic. Otherwise, this session would be very long. So that's why I avoided that. However, I can show you the salary because this was the question I was getting from the last 1 week. So what is the basic salary in the NHS if we pass MRCOG exam and we are working at non-trainee level? Then your basic salary, this is a rough estimate because every trust do have some differences, and your salary depends on your experience as well and the rank you are applying for. However, it is a rough at ST4-5 level, you might get 55,329 pounds per year. At ST6 or 8 level, it may be around 63 pounds, 63,152 pounds per year. Ignore the rest. So this is a rough estimate. If you divide 55,000 pounds, 329 into 12 months, if you divide that, then you will get your monthly salary. So this is a rough estimate. Okay, so if anyone left with any question, you may ask me.
I would like to uh, attend that lecture for consultancy that you said there's another route. So whenever you are planning that lecture, please let me know.
Yeah, sure, you will get the notification. We can do a session on that as well.
So presently you're working in UK, London, or some periphery?
Actually, I'm working towards my fellowship of Royal College of Australia and New Zealand. So I'm relocating to Australia this year.
Okay. Thank you, Dr. Sundar.
Welcome.
Ma'am, for ST3 post, we have to make an account on Oriel.
Yes. Let me show you. Maybe I can. Okay, I think I have written the wrong spelling. Okay, I'm not getting the website at the moment. Otherwise, I will love to show you. Okay, what happens? Yes, you need to make an account on Oriel. You need to complete your resume there. You need to add your clinical experience, your education, your status of visa and everything. You need to complete that file. You need to fill your CREST form. Let me show you here. Where is that slide for MSRA? Yes, here it is. Okay, CREST form is a form in which you need to get to complete the form and upload to the Oriel account. And after filling that form, you submit your application, and on that same account, you will get the notification if you got shortlisted, longlisted, in order to write the MSRA exam. So once you are longlisted by the Oriel, you're good to go and write your MSRA exam. They will provide you with your exam date. And once you given your MSRA result, your results again would be showed into your Oriel account. And same goes when it comes to your job offers, you need to check again your Oriel account. And this happens at the ST3 level again.
Okay, ma'am. Okay, thank you.
Welcome.
Recording in progress.
Okay, do we have any other questions, or should we close the meeting?
Sorry, but is it easier to move to Australia from the UK after the residency program or before the residency program?
That's a very good question. That's a very, very good question. Okay, so the answer is, to some extent, it is easier than UK, but at the same time, the AFRA have their own limitations, which is the regulatory body of the Australia. So there are many details. So we can do another session. What we can do, we can arrange a session in which we can compare UK, Australia, and the US pathways, so that you will fully aware about if you want to move to UK, what you need to have in your pocket, and if you want to move to Australia, what things you need to know, and if you want to move to the US, what you should need to keep in your mind.
Yes, please. We want to have that lecture or discussion.
Okay.
So it will have a better clearance, which place to move on. Because I think Australia, there is more demand of doctors in Australia right now compared
Yeah.
to, I don't know, but that's what I've heard from my colleagues. They were like, if you give MRCOG, you have that is acceptable even in Australia, UAE,
Yes.
and there you will get job easily rather than UK, because one of my friend is working in NHS. So she said it doesn't matter whether you work in UK or Australia. Australia also the standard of living is much better. In fact, UK is quite costlier because of the taxation. I don't know. I have no idea because I haven't been there, but that's what the people who are there, they are talking all these things. So you will give us a better clearance on these ground.
Yeah, basically, if you want to move to Australia, there are three pathways. One is the standard pathway, other is let me recall, one is the specialty pathway. The one you are talking about, yes, if you have your MRCOG, yes, you are good to go to the Australia through the specialty pathway. Standard pathway is as similar as you can say like a PLAB exam. Because the standard pathway is all about the basic exams. And once you clear two steps, which is AMC MCQ exam and AMC clinical exam, once you clear these exams, you will get your provisional registration through your license to practice in Australia, which is the standard pathway. Then in the specialty pathway, yes, if you have your specialty, your membership exam or your hometown specialty exam cleared, and you have some 3 years postgraduate clinical experience, you can directly apply to the Australia.
Okay,
Yes,
so right now I can directly apply to Australia.
yes, but there are some limitations because the challenging thing in Australian pathway, if you want to move to Australia, is their visa policies. They are not very easy people when it comes to offering a visa to a migrant, which is not in the case in the UK. UK people are more openly grant the visa to the migrants.
I have my US visa, so Will it be easier to get Australian visa on the basis of that?
Yes, you can take the chance. But another thing, in Australia, they prefer people who are onshore when it comes to the hiring. They do not hire people who are offshore.
Okay.
The chances for getting a job is good if you are
Yes.
in the US, in the Australia, and yes, if you have your PR.
Okay. 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 Thank you, ma'am.
Welcome.
Ma'am, but can we, I mean, you said like through after getting the MRCOG degree, we can apply directly to Australia. But I heard that if we are not trained in UK, we need to give AMC exam, even though if we have RCOG, MRCOG degree. So is that true, or like we can apply through the specialty route which you mentioned?
I think you can apply through your specialty route if you have your good amount of clinical experience after your specialty. Either you have specialty in your own home country, or if you have MRCOG and then you have a good amount of clinical experience, then yes, you can apply to Australia. But the challenge here is that they do not hire people much offshore. They prefer the doctors which are available onshore. They and they also consider the PR level, the visa status of the doctors they are hiring. So they do consider these things. So this is the major challenge when it comes to moving to Australia.
Understood, ma'am. Thank you so much.
Sorry, ma, the MRCOG route, is it the complete route or just part one, or, is enough? Or one has to have the complete part one, part two,
Yeah,
maybe part three before?
okay. I think you joined us late. I explained everything in the very beginning that if you want to apply or work in the UK, the first thing you need to have in your hand is your GMC registration. Without GMC registration, you cannot apply to
Sorry,
any in the
sorry,
NHS.
sorry, ma. Sorry, ma. I'm talking of the Australian pathway, not the UK.
Okay,
Is the
Australia.
MRCOG enough? Yes.
Yes, that is enough along with your clinical experience. However, I can make another video in which there are three pathways. Okay, I remember the name. One is the studied pathway. There is a specialty pathway, and the third one is your again I forgot the name, but there is another pathway in which they yes, competent assessment pathway. This is the third pathway. In competent assessment pathway, this is the pathway which is specially for those doctors who have some clinical experience in a good country, like the doctors who have cleared their USMLE step 1, 2, and 3, and they do have 2 years clinical experience in the US. They can get a direct job in the Australia. They got their provisional license to practice on Australia by AFRA. Then the doctors who are working in the UK, if they have PLAB 1 exam, PLAB 2 exam, their GMC registration, and 1 year clinical experience, then they can directly apply for a job in the Australia, and they will get the provisional license to practice without writing AMC 1 exams. I think I clear. And same goes with the Canada. If you cleared Canadian exams and you have 2 years of clinical experience, then yes, you can apply and request the AFRA to issue you provisional license to practice in the Australia without writing AMC 1 exam. So that means if you are applying through competent assessment pathway, your AMC 1 would be exempted. This is what I am trying to say. So you can take the chance at that level as well. Yes, if you want to apply to specialty route, you can do that. And yes, if you are more open to study again, you can write AMC 1 exam and move to write OET and then move to Australia for a job. I hope I made every point clear.
Yes, ma'am. Thank you. We are waiting for you another session for consultant level.
Okay, okay. Okay, by
Yes,
3.
ma. Thank you.
Okay, so we can do another session on Australian pathway with comparison with UK and US pathway. And another session we can arrange is for the consultants.
Okay, thanks a lot.
Okay, I think we should close the meeting. It was so much nice talking to you. Thank you so much for the participation.
Thanks for your guidance.
No problem.